What are genital warts is a question that has likely crossed many minds. To answer it, we need to look at the human papillomavirus, commonly known as HPV. This virus is a common sexually transmitted infection and can lead to the development of small, raised bumps on or near your genitals and anus, known as genital warts. People aged between 17 and 33 are most likely to develop these warts. It's worth noting that between 10 and 20% of the general population carry the type of HPV that can cause genital warts, but only around 1% of people with HPV will actually develop them. Unfortunately, as of now, there's no outright cure for genital warts. However, treatments can help manage symptoms and reduce their appearance. The symptoms of genital warts can vary. Not everyone with an HPV infection will develop them. The strains of HPV most often associated with genital warts are type 6 and type 11. Interestingly, about 90% of people with these two types of HPV never develop symptoms. If you do experience genital warts, you might notice a bump or cluster of bumps that are skin-colored or darker. They may have a raised, cauliflower-like appearance, and while they're usually painless, they might cause occasional itchiness or burning. These warts can develop in or around the vagina, labia, cervix, penis, scrotum, anus, groin, or upper thigh. There are over 100 types of HPV, but types 6 and 11 are responsible for about 90% of genital warts cases. HPV is primarily transmitted through sexual contact, but it can also be passed on through skin-to-skin contact, sharing sex toys, and childbirth. After getting the virus, it can take anywhere from a few weeks to months before genital warts or other HPV symptoms develop. Certain risk factors can increase your chances of developing genital warts. These include being between 17 and 33 years old, being assigned female at birth, smoking tobacco, having a history of multiple HPV infections, and living with an autoimmune disorder that affects your immune system. If you suspect that you have genital warts, it's a good idea to seek medical advice. Healthcare providers can diagnose genital warts through various methods, including taking a medical history, conducting a physical exam, performing an anal exam with a special device called an anoscope, carrying out a pap smear to check for the presence of genital warts and HPV, and taking a biopsy of the wart tissue to examine it under a microscope. In conclusion, genital warts are a common condition caused by certain strains of HPV, primarily transmitted through sexual contact. While there's no outright cure, there are treatments available to manage symptoms and reduce the appearance of the warts. If you suspect you have genital warts, seek medical advice to confirm the diagnosis and discuss treatment options.